Hi, I'm David Bradley of social and business network Revellers Club. I've decided to organise this Zoom meeting so we can all get back to revelling on 4th of July, safely for us and profitably for the venues that serve us. Joining us will be Public Health Advisor and Harley Street Medical Doctor, Dr Charlie Easmon. We'll also have the Dyson Award-winning inventor, Adam Sutcliffe, about his fascinating, very useful new Oorbell. We'll have a host of other interesting and useful guests providing advice and solutions. So if you are a venue owner, sit back and enjoy the show for the next 45 minutes or so. Well, not a show, a Zoom meeting. Yeah. Great. Okay, well, look, we're now getting on a little bit time-wise, 7 minutes in, so I think we'll crack on. The format's going to be really simple. The speakers, we're still waiting for Adam. Hi there, Alan. You're looking good.
Thank you, Dave.
The format's really simple. The speakers are going to give strictly 5 minutes. I've got my timer here, 5-minute talk, and then we'll all ask questions afterwards. Now, Edward, you'll join us. Well, that hopefully will be a good format for you, and it'd be very good when you have a question. Yeah. And same for you, Joyce. Just say a little bit about your business as well, and why you're asking the question, and that would be absolutely fantastic.
Sure.
Okay, so I'll just kick off. Famous last words. It's almost like a comedy. I'll just kick off. I'm organising as David Bradley Revellers Club. We run events. Or we did run events before all this COVID stuff happened. And I just thought it would be a good idea to reach out to my friends and people I know and friends of friends in the hospitality business to see if we can actually bring some clarity and some strategy and some interesting ideas and tools to help us trade, if you like, safely, obviously, but also profitably. And that's the idea today. So to begin with, we're very honored to have Dr. Charlie Easmon, who is a Harley Street medical doctor, no less. He's also a World Health expert. I hate the word expert because it's been a rather misused phrase recently. But anyway, so we've got Dr. Charlie to give us his idea about how we can go forward. He can speak from a lot of authority. He does a lot of testing for all these sort of things. And we've got Adam van den Bush, who is a top restaurant consultant, and he has a very specific idea about a strategy we can all deploy. We have Mark Nolan, who, although he wasn't on our website, I've relatively recently met Mark, and Mark has an extraordinarily useful and innovative product, which he has the intellectual property rights on, which is to keep surfaces or anything clean from COVID for about 4 weeks, and it absolutely kills the disease. And Alan has wearing one of these great snoods. Alan is part of the snood operation, and Alan can tell you about the snood as I can actually as well, because I know a certain amount about it as well. So we're still waiting for Adam Sutcliffe to join us, who is who'll be talking about his award-winning Oorbell hand sanitizer, which you wear and you rub, and off you go. You're very COVID-free at that point. So, Charlie, can you give a quick 5 minutes on just explain how you think a hospitality venue should go forward in relation to your expertise in all of this?
Yeah, so I think the challenge for the industry is at many different levels. One is, how do you maintain social distancing? The government today have just said that they're reducing it from 2 meters to 1 meter plus, which is interesting because everyone's just had all their signs put up saying keep 2 meters. So I think in reality, most people will probably, where they can, will keep 2 meter distancing. Places like pubs probably will go for the 1 meter plus because they need to pack more people into the venue. The question I think that a lot of punters will ask is, well, if I go to venue A, what are the chances that it's safe for me to go to, and what would I expect to see? And I think that's an interesting area of debate. I mean, I was saying to somebody, right, so say you want to take your elderly mother out for a meal to celebrate the end of lockdown, what would make you feel comfortable? And I'm guessing what would make you feel comfortable is the fact that there's appropriate signage to say that they've bothered to try to make it a COVID-safe venue. You probably wouldn't necessarily want to handle the doors in entry, so you'd hope that there'd be somebody there, probably gloved, opening the door for you and your mother. You'd hope that when you got to your table, you didn't have to go past too many people to get to your table. And you'd hope that when you got to your table, you felt comfortable that everything had been appropriately cleaned and there was almost an excess of hand sanitizer or washing station facilities available for you to see. The problem for a lot of venues is going to be, well, what do I do about my staff? Do I do what football clubs have done? And they test their staff twice a week for the actual virus. And to test for the virus, you're going to use swabs. It's not going to be cheap. That's the problem, because the basic lab cost is going to be in the 70s or 80 pounds. So you're going to pay quite a lot of money just to get that done twice a week. And you can see those costs mounting up very quickly. Alternatively, you may say, well, I want to see if people have been infected. And in that sense, you might go for an antibody test. The problem with antibody tests is that we know that 20 or 30% of particularly young people don't even produce antibodies, even if they've been infected. And Tim Spector, professor, has done some research on twins that has shown that if you follow up people who do produce antibody, then a percentage of them after 3 months lose their antibody. So we've got two issues there. One, some people don't produce any. And two, some people who had antibody lose antibody. So that raises huge questions about the likely efficacy of a vaccine. So I'm not optimistic that a vaccine will prove to be useful. There's another quote that I know from one scientist who makes the point that we've never successfully made a vaccine against an RNA vaccine to date. So that's a very specific part of that DNA. We've produced DNA vaccines, but RNA is a different version of that, and we haven't successfully done that. So I'm quite worried that a vaccine won't be the answer that everyone hopes it will be. So I think we're just still going to have to take precautionary measures, test staff, have very clear instructions to staff if they're symptomatic, probably wise to make sure all staff answer the basic questions. If you've got these symptoms, those symptoms, etc., before they come into work, they're not coughing and spluttering. And then where and when you can, use anything like a face covering or a mask, as depending on the situation. I think that's all I'd say for now.
Okay, well, I think what we'll do here is, if you've got questions, we'll leave those till a little bit later. As I say, I want all the speakers just to put their 5 minutes worth forward. Meanwhile, Adam van den Busch, perhaps you could be very kind and just give your quick 5 minutes on how you feel that we should.
Okay.
COVID.
So, you know, I work as a hospitality, restaurant, food consultant. I work for developers, I work for operators, I work for hotel groups. And, you know, I've been quite lucky to be quite busy for the last, during lockdown. And, yeah, really, I've seen some work come in, some new projects come in, and I've seen some work go slow. The new work is obviously around trying to advise people what to do, how to mitigate their circumstances by managing their outgoings, their costs, and trying to make plans for the future. So, I mean, the reason I'm in a car today is I've been working with someone on the Suffolk coast who has 2 restaurants, and we're working out how to reopen on the 4th of July, pending the detail from Boris later on today. You know, my point of view, the reason I joined the call was that, I mean, I think I've got 2 things to say. And when we come back to the detail, I'll go into more detail. The first thing is that, you know, hospitality has been very heavily hit, and, you know, everyone who works in hospitality is generally pretty good at being hygienic and being considerate and thinking about other people before themselves. And, you know, most people in hospitality have already got a list of 15, 20 things they can do to, you know, to help mitigate contamination or, you know, passing on the virus. Whether that be, you know, active cleaning, whether that be distancing, whether it just be clever ways of organising how they work and what they do, and using technology as well. And then there's the PPE and the various coverings and gloves and extra things you can do around those lines as well. But really, my main message is that, like a lot of people in hospitality, we are very worried about our futures, and the futures of people who work for us and our workforce. And, we think that 35% of the industry will go out of business this year. And so, for the most part, those of us in a luckier position feel that, we should be quite robust and quite brave and forthright and, act with common sense to reopen as quick as possible and to keep the industry buoyant, or as close to buoyant as possible, to serve people and provide the service which we normally provide. So, this week, a lot of pub groups have been saying, dear Boris, no matter what you say, we're going to just open on the 4th of July. Or they say we're going to open on the 8th of July. We don't care what you say. We've got to open. Otherwise, our livelihoods, our futures, disappear. So, my message today, when we come back to the detail, is the things that we can do to layer mitigating strategies to provide protection, and also to provide the perception of protection, because a lot of it is about perception, in my opinion. And try and champion the cause that people need to go back to living normally as soon as they can.
Okay, thank you very much. I'm now going to ask Mark Nolan if you can give me, Mark, a very quick summary of your wonderful, fantastic, and very efficient cleaning product.
Okay. So prior to this COVID thing sort of kicking off, I sort of got involved with this product, which we've called ProGuard Plus. Primarily, before COVID, what the product does is actually, it's a multi-surface cleaner stroke sanitizer, and it puts an electrostatic charge over a surface. So it attacks biofilms, which is on everything, puts a coating over it, which is positive, which stops further bacteria landing and sort of getting the infestation. And then, and it kills it. So after this COVID thing had started, I sat with a chemist and said, does it work on viruses? And he sort of looked at me like a teacher to a child and said, yes. I said, does it work on COVID? And he said, yes. It works on enveloped viruses. So SARS, whatever, are all enveloped viruses, and basically it pops the bubble. So this was the original bottle that we got, which is ProGuard. It's all made from sustainable products and eco-friendly. And basically, just a cleaner like you would clean the kitchen with. But also, when you use it like this, it's a hand sanitizer as well. So, and you can feel, it's dry now, you can feel a coating. It's not sticky or whatever. It feels like a thin wax coating. So you can use it as a cleaner on a surface. You can spray it on handles, banisters, touch points, all the rest of it. Because it's electrostatic, it wraps itself around the surface, putting like a positive charge on there, and then stays. So it can be sprayed and wiped as a cleaner. It's a great cleaner. It can be used in toilets, kitchens. It's safe for food, animal husbandry, vets, all that kind of thing. And as I say, it leaves this charge there that stops bacteria from growing, stops the coronavirus, and lasts for a long time. Where other sanitizers, especially alcohol-based ones, once they're dry, they stop working. And if they're heavy alcohol-based products, so they're more effective, the quicker they evaporate. So yeah, we've come up with this. It's doing quite well, especially in exports. It's not doing that great in the UK, but nor did I expect it to, because the UK is a very sort of closed market. But we're doing so well in Spain. We're actually producing, this is the new bottle, new logo and everything, in Spanish. So they're being shipped to Spain. It comes in a 750 ml spray bottle, or in concentrate, which can be diluted down and used in a reusable, bottle that you might use in a kitchen or in a pub or whatever. Simple to dilute. You just mix it with water. So put your water in first, top it up with concentrated ProGuard, shake it, and you're ready to go.
So, and it's biodegradable. It's biodegradable, and what's the certification just to confirm, please?
Well, I can't remember off the top of my head. Everything's on the. There's loads of information on the website, but it's been tested to EN 1272 2008. It's ISO 9000. It's 1278 13697. And we're having it actually tested now in Spain by the ministry. I've actually got, because we're doing all the work there, I've got something somewhere.
Okay, it's certified.
Yeah, it's certified.
It's certified. Okay.
It's been around for an awful long time. The original formula was harsher, and it was actually to treat black spot mold and algae.
Right.
So people would use it on driveways and things like that. So we've developed it now to be more refined and more eco-friendly and much safer to use. But it does what it says. And,
okay.
The customers are buying it regularly. The biggest test for me, I'm not a chemist, the biggest test for me is the customer happy?
That's really great, Mark. Thanks very, very much indeed. We'll have some questions to ask about that in a few minutes. Yeah. I just want to quickly move on to Adam. Perhaps you can give a quick rundown of your very exciting Orbel. By the way, viewers, Adam is a Dyson Award winner for innovation. Is that right, Adam? I think it's innovation. Invention or innovation, one or the other. And so here's the real thing. And anyway, so Adam, do you want to just give a quick intro to yourself? And I've got a picture. I'll do a share of screen in a minute. I managed to work it all out, cut through the technology, and I can demonstrate the product in a minute. But why don't you just explain what it is? And
I think I'll start by explaining what it is I do. So I'm embarrassingly called an expert in human-centered design. So what that means is for the last 20...
By the way, Adam, you've got 5 minutes, just so you know, because you missed the beginning part of this. Okay.
So what that means is for the last sort of 25 years, I've been helping companies and individuals design from a sort of a user, consumer, customer perspective, but to meet business needs and to meet product needs or service needs or experiential needs, and even, whether that is in the physical realm or the digital realm. And within that is a combination of not only putting the user at the center of it, so thinking bottom up, but at the same time having a top-down understanding. And what that allows you to do is again sort of have your feet firmly on the ground, but your head in the sky. So you're keeping an understanding of all the stakeholder needs and all the sort of the procedural requirements or legislative requirements or mechanical requirements or environmental requirements, but still but not allowing that to constrain your imagination. And eventually what that happens is that you basically come up with things that are really innovative. In doing that, one of the things I came up with, which is what David was alluding to, is this device called Orbel, which we're selling at the moment. It's I don't know if you've got the picture there. So that device is called Orbel. Basically what it is a hand sanitizer. It contains alcohol gel. I designed it for use in hospitals. And the reason I designed it for use in hospitals was that when I was at the Royal College of Art, we were set a task of finding places where people live, work, play, finding a problem and solving it. So it's literally find anywhere in the world to solve a problem. And so for me as a human and as a designer, I'm about improving people's lives. And so spent 2 weeks at Chelsea and Westminster in A&E. One of the issues that came up with was the fact that healthcare workers, nurses don't clean their hands as often as they should. Then I looked into why that was. There's lots of reasons. They're too busy, they're too stressed, they can't be bothered. The environment doesn't allow for it, and they forget. And the forgetful one is interesting because the World Health Organization and the NHS are on at them continuously to clean their hands, and that you get trained and reminded every 2 weeks. They put up posters and change the design of the posters and the location of the posters every couple of weeks, so people don't get desensitized to the messaging, but they still don't do it. So I felt that I needed to design something that was as easy as possible to use and ideally habit forming, so subconscious to use. So that's why Orbel looks the way it is and works the way it is. So how you work it is you just wipe your hand down the face. You get enough gel on one hand for both hands. So the first thing is, if you want anyone to use your product, your service, whatever that is, you've got to reduce the barriers to entry. It's got to be as accessible as possible. So that's why it's worn. That's why it doesn't have a cover on it. The second thing is the wiping action. If you think dirty hands, you want to wipe your hands on your trousers. So the wiping action is a bit of muscle memory. And then finally, thirdly, it feels nice. As you roll your hand down those balls, they rotate, and it feels nice. And we think that's what triggers the pleasure reward response. But I think probably not necessarily most importantly, but quite interestingly, is the aesthetic side. And it's something that I want to talk to you guys later on about, is what the aesthetic of this does. It's designed to look different, even though it was going to look different from the functional aspect anyway, but it's designed to look different so that it not only encourages a conversation about hand hygiene, because if you're a patient lying in bed, you're not about to stop a nurse before he or she gives you an injection and goes, "Excuse me, have you cleaned your hands?" But if you see this bizarre looking object, you're potentially going to ask, "What is that?" And then the healthcare worker can start a dialogue. But over and above that, if you see it, Orbel, it's a utilitarian product. By wearing it, you have to use it. It's not there not to be used. It's not kept in your pocket. It's not like having a gel dispenser on your lanyard that's got a cap on, because that cap can always be on. This, by its nature, is something that is worn to be used. And I think that's quite an important thing in the conversation we'll have later on, is trying to understand how the environments that you all work in, how you can design them in such a way that they don't affect the service that you're giving, but do convey a sense of safety and well-being.
So very useful in a restaurant context, for example. A waiter or waitress could wear one of those, and before they serve or whatever it is, they could just Orbel their hands, as it were, and it gives a sort of a message of reassurance to whoever's dealing with them or being served by them. But is that the general idea?
Yeah, that's right. I mean, I'm keen not to, I'm not here to push Orbel per se. What I'm really here to do is try and encourage people to think a little bit differently about how they approach the issues around that environmental change and enhancement of their service and their offering, so that it's not just trying to, not trying to peg into a round hole. You think it's a little bit outside the box and think of it from a customer perspective as to how they can deliver or evolve the delivery of their service or offering to get back to business as soon as possible. So,
okay, brilliant. Well, Adam, many thanks indeed. And I'm now going to try and unshare my screen. There. Great. Well, look, we'll come back with some questions, no doubt, in a minute. So finally, Alan. Hi, Alan. We're going to now talk about the snood. Okay. Do you want to talk about this a little bit, or actually you've put it the wrong way around? It does actually have a...
You lost the logo.
Yeah, I lost the logo. Hang on. I'm in terrible trouble now. Hang on. They paid a fortune for sponsorship. There you go.
So the origin of the Virostatic shield, it came from a guy called Paul Hope, whose grandfather died from the Spanish flu, and they made it their life's work to find a way to stop that from happening to other people. So it's been 10 years in development, where they've developed a protein which covers the material on the mask, which is now called viruferin. And the protein, it binds to the virus, and it works both ways on the mask, so it prevents the virus passing through in or out of the mask. And it captures the virus so that such that with other masks where you may, once the virus is on the mask, if you put it down or someone else picks it up, it gets transferred. With the Virostatic shield, the virus, it will stay on the mask. So it adds that level of security there.
And you can wash it as well, yeah.
So you can, at the moment, the evidence is on hand washing only, and it's in the labs currently to establish exactly how many washes it will still be effective. At the moment, it's looking at 300 hours. So if you're comparing the cost price of a variostatic shield against FFP3 or FFP2 options, the standard surgical masks, then rather than it being disposable, you get much more use out of it. So how I came across it was I'm involved in telecom and the security services part of that. The guy who's involved in printing the masks was involved in printing security ink. So that's how they've become involved in putting the coating onto the material. It's a UK company. Again, a lot of people, when they're looking at the source of masks, you know, it's coming from other countries. You know, supply is an issue. Here we have a solution which is manufactured in the UK, and they've just scaled up production now so they can deliver, I think it's 300,000 masks a day is the last count.
Okay, well, very interesting.
Okay.
Any questions? We'll come back to that
Sure.
in a few minutes. So, well, unfortunately, Adam seems to have left us. I don't know, but anyway, never mind. Edward, do you have any particular questions on what you've heard?
Yes, I'm Edward Palin. So I work for a company called the Filter Group. So we're a environmental services company, and we've spent the last 2 months networking, really trying to understand what technologies are out there, sharing ideas. Our core market is pubs, hotels, restaurants, and we work and provide a range of not particularly glamorous environmental services, things that happen behind the scenes that you don't really think about. Recently, we've got involved in supplying thermal imaging equipment. We've got a similar product to Mark and sort of similar type of service. And we're working with some of the bigger pub and restaurant chains. And really, I think it's about behavioral change. It's about how long this lasts for. That's what, you know, I'm most interested in. You know, is this a short-term adjustment to our behavior, or is it a long-term adjustment to our behavior? And how can safety and social environments exist in harmony? I think that's, when people go somewhere, especially restaurants and hotels, to relax and be with people. How can you relax and be with people without feeling like you're in an environment where everything's overly protected? And I think that needs to evolve. I think there's certain technologies yet to come that may well lend themselves to that. And in terms of questions, I thought what Adam had, I think it's fascinating, the technology you have. I think it worked really well in a restaurant environment. The variostatic shield is incredible in terms of its presence. I think it's been incredibly well marketed in recent weeks, and it's really filled a niche. You know, one of our areas of operation is in water treatment, and we're finding drains are blocking up with masks now. You know, it's the next environmental problem because they're disposable, they're thrown away, and they're washing up on, you know, the banks of the Thames. So I think something that has got sustainability is really, really important.
Yes. Well, that's a very interesting perspective, which I don't think many people are aware of that right now. You know, we have the problem with plastic. Well, the next one's going to be with the masks, and people will assume they're still infected, which would be rather unpleasant as well. So, yeah. Yes.
And I think it's a very good point you raise about, you know, if we knew what was going to happen next week or the week after, it'd be a lot easier. But as you see the second waves and outbreaks in different countries, you know, although you've got the optimistic view of everything's going to be fine, we can get back to normal pretty soon, as Boris Johnson tells us today. Or you can take the more pragmatic view that this is going to be around for a while, maybe a year, where we have to adjust our behavior. In which case, what tools can we use to get on with life? Because you know, the economy can't stop. So, what are those tools that we can use to get business back to normal and conduct the social life that we used to?
We have a public health, she's a chartered member of the Institute of Environmental Health that works for us. And you know, she was saying, I think in Korea, they're now using track and trace to such a point that you can track it right back to a particular warehouse in a factory. And therefore, you know, I think the burden of an operator is actually suddenly you need to prove that you're taking measures. You know, in the same way as you have an E. coli outbreak, they'll be tracing through track and trace a property that, you know, you might go to a nightclub and suddenly there's an outbreak. And I think that's probably the next phase in this sort of evolution of this whole interesting marketplace. I think people do need to be aware that there's protection. There'll be a class action suit somewhere in the world at some point of someone suing for not having adequate protection against coronavirus. It will happen. So, and I think from an operator's viewpoint, I think that's something they need to be aware of, and I don't think really the market's responded to that yet.
Can I just, we haven't heard anything from Joyce. I just want to, Joyce, could you just let us know a little bit about your business very briefly, and if you've got any questions about this or have any question at all about the COVID situation, why don't you air it with the experts present?
Thank you, David. So my interest in all of this, apart from being a consumer and a human, is that I am embarking on doing some work with tourism organizations. And as you were saying, David, you're in the events, and we've got people in the hospitality. So I'm looking at how to promote certain events and destinations. And part of that is understanding how they can ensure confidence in the consumer, or the guests, or the visitors. Yeah. So that's where my interest comes from. And really, I'm thinking about, so all these wonderful products, from the snood to the hand sanitizer device and the spray, all great. But how do organizations or how do they sort of have some sort of certification? So once all these protocols are in place, what kind of, again, it's about instilling confidence. So what kind of certification would inspire confidence, really?
So, yes, Charlie, what's your view on that?
Yeah, because I think that's the thing I was going to raise is, do we think that, taking this point about litigation that the colleague made as well, do we think that restaurants, pubs, all these sort of places should have a form of certification to say, this is what we've done, these are the standards that we've complied with, and then you as a consumer can make a choice? It's a bit like, the hygiene rating. You've been absolutely mugged to go to the kebab shop that's got a hygiene rating of 2, but some people do. So the question I would ask is there a need for that? Some level of certification that makes you think, my God, they're the gold standard. I'll take Granny there, but I wouldn't take her there because they either have no certification or they've got a shit rating.
Yeah, I think that's something that happened, or starting to happen in Sweden, where businesses are taking it upon themselves to, I saw an article, I think it was in the BBC News, where every 2 weeks they have all their staff tested. The staff are tested by the Red Cross. The cost of that is covered by the local government. And they're able to confidently say, we have this protocol. And I think you're absolutely right, Charlie, that certainly now that's something that an individual organisation will have to take on. But I don't think, I would hope that it's fairly inevitable that the government will then roll out that as a nationwide thing, not necessarily insisting it initially, but providing it or facilitating it. And I think to your point, Joyce, or your question about confidence, I think it comes down to a number of things. One is before people choose to come to somewhere, they need to understand that destination, whether it's a country or an actual a restaurant or whatever, has a scheme in place, understands what it is doing to take responsibility for not only its staff but the environment. Number one, and I think then the other part of that is, consumers. We're all consumers, right? We're inevitably going to be concerned about the effect that this has on our experience. So, our pub's going to be the same. If I go to a restaurant, am I going to have to sit in a bubble or something. You know, there's going to be that's going to, I think, be one of the greatest barriers to people coming back is the experience going to be the same. And so I think to promote confidence, part of the promotion of confidence is to demonstrate that up front and go, look, things are pretty much the same. The only differences are this. And then back to that, and back to Edward's point is, I think it's really important in whatever you do that it's done from a consumer perspective. So on the one side, you've got this top-down, you must put these measures in place. However, there's always going to be a little bit of grey area, a little bit of, well, we don't have to put black and yellow tape everywhere. Maybe there's a very subtle line, or just being a little bit more, a little creative, but still within the guidelines to ensure that environment is welcoming and a joy to be in. And one of the ways to do that, or to know that you've got it right, is to go through that environment as a consumer, because all the images that I've seen online have basically been, looks like management's come around and put a load of tape down and go, right, we'll do this. And I'm like, well, have you had 20 people come in and actually use this pub and 20 mates come in and got feedback from them as to what works, what doesn't work, how the experience could be improved? That's one way of doing it.
Does that help you, Joyce?
Yes, thank you very much. Definitely.
That's great.
Yeah.
Now we have Terry with us, although we can't see Terry. Terry, can you say something so we know you're here?
Yeah, hi.
Hi, welcome. Terry, do you want to just introduce yourself and say a little bit about your business and what your big question is?
Yeah, I run a restaurant bar in Clapham High Street. It's an independent unit.
Okay, and what's your biggest, I mean, you mentioned your biggest challenge to me earlier on, but can you just articulate what your big question is about all of this and what you want to get from this?
Well, it's the distancing, the social distancing is our biggest concern. And also it would be good to know the size of restaurant bookings, like customer groups, and if there's going to be any curfews imposed as well on closing, because we are a late night restaurant bar operation.
Okay, and so do you have music and dancing and all that sort of thing? Or?
Normally, yes, we have a DJ. We don't have a dedicated dance floor. People tend to dance wherever. So our plan is to just make sure everyone has a seat. So that in itself is going to control the numbers. So we're going to have less people in the venue.
Okay. So, yes, Charlie, why don't you...
Well, my question for people like yourself, Terry, is whether we can get away with a Trump rally style no sue clause. Because, as you say, if you're going to have a late venue with a bunch of people, what you don't want is that one of those then tries to sue you later because, the person in the middle was coughing, spluttering and causing an outbreak. So I'm just curious whether restaurants and places like yours could get away with introducing a no sue clause, i.e. you are taking the risk yourself and you cannot then hold us liable if something happens. We've taken a level of protection, but at the end of the day, it is your own risk.
Yeah, well, we do plan to, test the staff when they come in, make sure they're feeling okay, possibly a temperature check, etc. But I think it would be quite difficult for someone to identify where they caught the virus, to be able to say they caught it in a particular venue.
Well, we did hear earlier that Korea can do that. They have such a defined level of track and trace. I think scientifically, Britain at the moment hasn't got that, but it doesn't mean Britain couldn't get that within the next few months. Apple, Google, all the technology people will be involved. So it's not inconceivable that Britain will be able to do that at some point in the future. And then the person can say, look, the only exposure I had was Terry's club, therefore Terry's to blame.
How would they sign up to that? Would they have to sort of scan a QR code with their phone, which would imply that they've accepted those conditions, or in order to get into the venue? How would that work?
I've got a quick one to add to that. So the government has said that they're going to insist that and I don't know how they're going to do this, but they're going to insist that the contact details of everyone that comes into a restaurant or bar is collected so that can support track and trace. And I think what we've seen in other countries is that in order to do that, one of the mechanisms is that I don't see how this is actually going to work, but you pre-register. So you say, I am coming down at this time, and these are my details. And within that, you could potentially have a clause which says, you know, I appreciate that I'm not going to sue, or I accept that I'm not going to sue the venue. That said, though, I was talking to a friend the other day, and the issue one of her schools is having, one of the schools for kids is having, is that they can't get the insurance to protect themselves against being sued because the insurance companies haven't picked it up. So we're definitely in a bit of a grey area. The other question you had, Terry, was like group sizes. Now, the government have said that 2 households can meet irrespective of their size. Now, this is a little bit the grey area, but you know, there's you as the owner or the proprietor of a venue don't have the responsibility to validate whether people are from the same household, right? It's self-certification. So, because that's where the liability lies. So if someone's coming to the venue and they say there's 20 of us, as long as they say, well, actually, it's only 2 households, then you're in the clear, all right? So you just got to really support that environment and go, well, yeah, we can accept 2 households, nudge, nudge.
Yeah, very interesting. Right, well, we've got 5 more minutes left. Anyone else have any particular question that they want to ask?
Yeah, I've got a question for Terry. Is what are your thoughts on it? How do you think things are going to have to change for you, and what are you doing to address those changes?
Well, we're quite fortunate because we have placemats. Our menus are our placemats, so they're one use for menus that we use. We plan to not have salt and pepper shakers. We plan to have the sachets. We also plan to have reduced or probably a set menu. We haven't 100% decided on that, but we're thinking of having a set menu. The menu we have is a Greek menu, so it's sharing, which I'm pretty sure is not the best thing under the circumstances. So what we plan to do is, for example, I don't know if you're familiar with Greek restaurants, but when you get your plate, you will have your portion on your plate. So your starters will come and you'll have a selection of starters per person. And that's, so with having the set menu, it should be easy. It's not going to be a long drawn out taking of the order. The allergies might be an issue. So we sort of have to communicate that with our customers. So there's not too much conversation with the server and the customer. And then the other issue we've got is toilets. Fortunately, again, we have a lot of toilets. We have a lot of cubicles for ladies and gents. But even so, we're going to have to probably organise some sort of queuing system. We do have toilet attendants, to be honest with you. So we probably have to organise some sort of queuing system for the toilets. That's our concerns. So the biggest concerns is that are the toilets and the, you know, making a customer clear. You know, we're going to install sanitisers in the entrances and around the venue, and signage to encourage people to, you know, clean their hands and stay apart.
Well, yes, Charlie.
Just a quick question, Terry. How many staff do you have?
22 at the moment.
And then what is your strategy with staff testing, if you're going to do it at all?
Yeah, we're planning to. So when they come into the venue, they'll sign in as they do on their shift. And we're going to have a form, which is going to be a tick box form. So it's fairly quick. And, you know, what we will do is we'll probably take their temperature, or someone will take their temperature, ask them if they're feeling well, ask them, you know, if they've got a fever, a cough, etc., etc. Obviously, and then we will obviously be observant on that as well.
Well, what sort of tools are there to take temperatures are there on the market at the moment?
Well, the thermometer, the one that you point at someone's forehead, you don't have to contact them or anything. You just point it at their forehead and it gives you a reading.
There is one tablet I know, where you put a tablet up somewhere, you put it onto the wall, and apparently you walk past it, and if someone's got a temperature, it'll automatically go ping.
So, David, we provide those thermal screening systems. So it goes on a stand, you walk past it. So we put it into quite a few schools, offices.
All right. How much do they cost?
Between £2,000 and £5,000.
Right. Okay. So you justify that because you don't have to spend quite so much money on staff. Or you said
Obviously, it reduces the staff cost. I think one of the issues is, confrontation. So, you don't really want to run a restaurant. You've got 10 people coming in and one guy, scanning. The fact that you're actually scanning a person means you're getting within 2 meters more than likely. Yeah. But then you've got a confrontation of saying, sorry, you can't come in. And it's a very difficult situation to be in. So if you've got a system which is effectively entirely independent and you can screen yourself, see your temperature, you're sort of self-monitoring. So it's a different dynamic.
Okay. All right. Well, look, everybody, we are now at 6 o'clock. Thank you very much indeed for coming on to the program or the Zoom meeting. And if you've got any questions or you want to reach out, just send me an email. You've all got my contact details and I'll put you all in touch with one another so you can work things out. Okay?
Thank you very much.
My pleasure. David. Well, thank you all very much for coming along. That's really great.
Good to meet you all.
Thank you.
We'll all speak soon anyway. Bye, Joyce.
Bye-bye. Nice to meet you all.
Bye, everyone.
Thank you.
Bye, everybody. Have a great evening. It's
Thanks,
still shining. It's nearly the longest day. It's just been. So enjoy the evening.
Thanks, David.
Okay. Thanks a lot.
Bye-bye.
Bye.
Yes, thanks. Bye-bye.
Bye.
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 Bye.